Hi, my name is Lauren Masi. I'm a doctor of physical therapy and a board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today, we're going to talk about what you should expect from your first physical therapy visit. Physical therapy can offer a comprehensive look at the whole you. We're going to watch you move, we're going to incorporate your posture, how you function, and make sure that we can get to the root cause of what brought you in and get you back to all the things that you want to do. When you're preparing for your first visit, please make sure that you dress in loose-fitting clothing. We want to make sure you can expose the body part that we need to look at more closely and have it not impede in any motion so we can see exactly where we're starting. Also, be ready to offer an extensive medical history. We know that you filled out paperwork before you came in, but as you start to tell us your story, we may have more questions, so please work with us on that. Also, we want to make sure that you as the patient are very involved in your care. So we're going to ask you what things aggravate your pain, make it worse, and also what things make it better. We also want to know what your goals are. You might have different goals than the next patient who walks in after you. We have athletes to geriatric patients. Some people need to get back to sport, and some people just want to be able to lift their child or grandchild. So we want to know what matters to you so we can make sure that we customize the program appropriately. Then we're going to move into the testing phase. This is where we might palpate different joints, soft tissues, muscles. We're going to watch your range of motion, take some measurements. We're also going to strength test the areas involved and maybe the areas surrounding the joint or painful area as well. We want to make sure that we watch you move. Depending on what we're looking at, that could be reaching overhead, that could be going from sit to stand or squatting, even just walking or jogging. We might take some videos if we need to slow down motion to look more in depth. The weird part about physical therapy on that first visit is we're going to try to reproduce your pain. I want to be able to see what body structures are involved so again, I can get to that root cause. So that first visit, we might elicit some discomfort as we're having you squat if you're coming in for knee pain. But as the saying goes, if it's reproducible, it's reducible. That really helps us make your pain better and get you back to the things that you want to do. Once we've collected all the information that we need for your testing, we're going to make a customized plan of care. So again, for our clinics, that definitely involves one-on-one physical therapy with your physical therapist. There's going to be a hands-on component, which could include soft tissue massage, joint mobilizations, and even just guiding your body into the positions that we need it to that maybe it hasn't been in a long time. We're going to work on giving you stretches and strengthening exercises that you'll do in clinic with us, where we can watch your form and give you appropriate cues. And then we're going to make sure that you have some things to work on at home. Again, you're only coming into physical therapy maybe a couple times a week, so the biggest change that you're going to make is the commitment you put in at home. When you're in clinic too, if you are struggling and suffering from pain, we have modalities which are machines that can help control your pain. Those things include electrical stimulation, ultrasound, and we're one of the few clinics in the area that actually have a class 4 laser that can help with pain and inflammation. A lot of professional sports teams have that laser and use it to get their athletes back on the field as fast as possible. So again, that first visit does take a while. It's usually about 45 minutes to an hour to make sure that we can do that full comprehensive examination, looking at the whole you, making sure that this is all about you and getting you back to the things that you want to do. And we definitely will aim to get some treatment done that first day. We want to get you back on track as fast as possible. If you'd like to set up a complimentary consultation or schedule your evaluation, please call our front desk.